One of the people on the front line of the fight to counter the opioid crisis is the head of the Public Health Agency of Canada, Dr. Theresa Tam. I met with her to talk about what can be done about the evolution of the crisis and the debate in at least one province, Ontario, which has put a temporary freeze on new safe consumption sites. Dr. Tam started with reflections on the complexity of this opioid epidemic.
It is a very complex problem, and one that is been building up for several decades actually, and then further ignited by the toxic drug supply that is fentanyl and its analogs. So you've got a complex picture of an overlapping phenomena. And I think the most challenging thing is, I study pandemics and infectious disease, SARS and influenza, Ebola. There are definitely similarities as well as differences. The spread of the toxic drug supply, for example, is a bit like a virus, and it's sort of this escalating rapid peak that we've been seeing. But it has underlying factors, as I said. People in have different stigma and discrimination in those populations, and the trauma and the mental health challenges and the chronic pain is what is the underlying fuel for this epidemic. So that means that so many people have to be involved in order to address what's going on. And we need a very broad, holistic approach, which goes all the way from essentially harm reduction, treatment further upstream, and then prevention, which is also very important.
I guess that's the question, because a lot of people watch, and we here on CPAC, we've covered summits, we've covered multi-layered meetings with municipalities, with federal, provincial, yes. All of these authorities. You've been at a lot of these meetings, these summits. Are we learning, are we doing something better now than, say, 2 years ago?
Absolutely, and we can't predict where this epidemic would have gone if we did not put down some of the measures. So if we started off, we can't help people if they're dying, and so making naloxone accessible, for example, that is an antidote to reverse an overdose event. And then the safe consumption sites are also important in terms of providing a safe place that does not discriminate, and where people, if they are overdosing, they can be looked after and deaths prevented. But that's really quite important to do. And at the start of the epidemic, we had 1 to 2 safe consumption sites. Now we have over 25. So that's a rapid escalation. I'm seeing naloxone being better distributed, and the federal government making it more accessible. And making treatment drugs more accessible. So, making injectable heroin, for example, pharmaceutical grade heroin, lowering all those regulatory barriers has been done. But there's still, we are just beginning to increase the amount of treatment that people can access.
When you say safe injection sites, or safe consumption sites in this case, you know that for some people alarm bells go off. The Ontario government, the new Ontario government, has just ordered a review, a freeze on opening of any new safe consumption sites, and a review. So we don't know where that's going, but a lot of health professionals and a lot of people involved in different levels of government have raised an alarm. As a medical practitioner, as Canada's Chief Medical Officer, any thoughts on that review by the Ontario government of safe consumption sites?
I think having an evidence-based approach is very important. We're also facing a very urgent crisis, so you don't always have the perfect information before you act either. But what we do know, and I think from the federal level, the evidence that we have is that safe consumption sites do save lives, and they do not increase crime in the vicinity. And they do bridge people to treatment and to social services. And we've been collecting some statistics from about 13 safe consumption sites who've reported over 127,000 visits, of which there's been over 1,000 overdoses and no deaths. So we know that those 1,100 overdoses have been successfully reversed.
You're in the harm reduction business, you're in the health business, but what about when you hear people say safe consumption sites encourage drug consumption? Safe consumption sites are condoning drug consumption, and so are you worried about a backlash against safe consumption sites?
Well, I think it is important to provide the public with actual facts. So what we do know is that these sites do save lives, and that is the primary objective when there is an urgent public health crisis going on. And they do not increase the consumption of drugs. That's not the facts that we have. But what I do have to say is that Canada has gone from 2 safe consumption sites to over 25. It is important to collect information and to evaluate them. And this model is not necessarily the model that every community needs. I think the solution has to be local. So as you can imagine, a fixed site, for example, can only be accessed by people just surrounding it. And so the data showing where overdose is occurring and the consultations with people impacted by the overdose, it's very important to know where to locate them. But there could be mobile sites, there could be other harm reduction measures that are not specifically safe consumption sites as well.
Okay, I'm going to ask you some snappers.
Yes.
What are we not doing well enough?
I think we need to increase access to treatment. So that is fundamental.
So this is hospital beds, this is outpatient clinics, this is treatment clinics?
It can be a whole range of things. It is also increasing opioid-assisted therapies, and also, as you said, psychological treatment, all the wraparound services as well. And so that means social service, social support is really important, and that needs to be broadly escalated.
What are we doing better now than a year ago?
I think harm reduction is a shift, and it is a public health approach, and we finally are beginning to embrace this. So I do think that having safe consumption sites, naloxone, zone, that is a really important improvement.
Your biggest worry, I mean, as someone who watches this and is seized with this pretty well every day, your biggest worry?
My biggest worry is still that the whole of the Canadian society isn't recognizing this is just at their doorstep. This is a critical issue, and that we need to reduce stigma and discrimination and really effect a massive overarching whole of society response to this.
I mean, I'll be personal. It's almost mind-boggling the scope of the damages, the scourge that is the fentanyl and the opioid crisis. Does this surprise you? Are there days when you wake up and say, I never thought I'd live to see the day when 8,000 people have died in 3 years, when 4,000 people died last year? Like, does it sometimes baffle you too, or is it just the way it is?
Well, I think we also saw the HIV/AIDS epidemic that peaked in the 1990s. And so these events do happen. And again, I would underscore that we have some fundamental root causes here of social, economic, psychological conditions. And we need to, as long as those conditions exist, something like it could still happen.
Last question, because we started, you are an epidemiologist, so you love figures and trends.
Yes.
We started with the statistics. Is it going to get much worse before, I mean, it's an unfair question maybe, but is it going to get much worse before it gets better?
I don't know the answer to that question. It has been getting worse, so that is a concern. But what we're seeing is that so far the first quarter of 2018 is similar to what we've been seeing in 2017, but it's still too early to tell where this is heading. But I am, I think that we need to continue to encourage a full-on response.
Have we seen, I said this is the last question, have we seen it arrested in any way? Because sometimes I saw some quotes out of BC saying that they think that the rate of growth is slowing and they might even be reaching a peak. Do you have any evidence of that?
While it's too soon to tell, if we looked at the epidemic trajectory, so 2016 going up, 17, it is at about the same rate as the last half of 2017, which is why British Columbia and Alberta are saying that the rate of increase may be slowing down a bit. But I think everybody is trying to be extremely cautious about this because it only takes some further changes in the
drug
factors,
supply,
exactly, whether it's supply or vulnerable groups.
and potency of it, and yeah.
That's right, to change the trajectory. So I think that's why we need data also to inform our decisions.
And that's part of your business. Dr. Tam, I want to thank you for speaking with us. It's been really informative, and it's a very, very important issue. We'll speak again. Thank you.
Thank you.